Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you so much for joining me and my guest. My guest is Katelyn Kirby. She is a public health nurse in the city of Quincy. We are here to talk about understanding the brain. So welcome back for this particular topic. It's great to have you on any topic.
Yes, thank you for having me. This is definitely, of course, the brain is a very vast subject. So this will specifically in hopes to bring awareness to traumatic brain injuries. So we'll go over some of that information of what to look out for and when to seek help, of course.
We had done a program on the brain, I think about 4 years ago. But as you mentioned, it's a complex organ. So it does require, or does certainly warrant another look. And this time focusing more on traumatic brain injury and such.
Yes.
So let's begin with the overview for everyone at home, and of course for me too. This centers me as well. So we will start with the definition. What is the brain? We will look at definitions of brain disorders. What is traumatic brain injury, also known as TBI? TBI's symptoms, neurological and physical. TBI symptoms, cognitive. How does traumatic brain injury affect mental health? What is the treatment for mental health issues after TBI? And does age matter in brain injury recovery? I'm going to venture and say yes, but I'll find out. And then we will end with resources.
Yeah.
So, what is the brain?
Yeah, so you'll see very complex topic because this controls your entire body. So the brain is a complex 3-pound organ that serves as the body's central command center.
3 pounds.
Yeah, so this controls our thought, memory, emotions, motor skills, our vital automatic responses like breathing and heart rate, so things you're not even thinking of. It's located, of course, in our skull, and it's part of the central nervous system, which is composed of billions of neurons, and that is essential for human functioning. So basically, it's all electrical charges, and that is, my brain is telling my hand to move. A lot of it is natural to us and becomes habit as we're moving. Like I talk with my hands, it's a habit.
Right.
But the key components and functions, so there are 4 key components. So the cerebrum, that's the largest part that is responsible for high-level functions like thinking, learning, memory, and emotions. The cerebellum, which is located at the back, it manages voluntary movement, balance, and fine motor skills. The brainstem, which connects to the spinal cord, which controls all the automatic life-sustaining functions like the heart rate and breathing. And then there are the lobes of the brain. They're divided into lobes like the frontal lobe, which is for thought and personality, the parietal, which is for senses, the temporal, which affects your language and memory, and the occipital. So it's important to know because all those different areas of the brain, with a brain injury, it depends on which area and what is impacted, really would impact what that individual may see after the injury.
It amazes me, and I know that there were components to the brain, but it's so compartmentalized.
Yes, yes. And you want to think like your body is all a system, so it works together. And as humans, we know what to do. We know we have to eat healthy, hydrate, rest, follow up with the doctors and so forth. But it's just important. I'd like to cover this because it goes into why to look out for this and why to be aware of it. It's just kind of reminders.
As we look at brain disorders, there are a number of common brain disorders.
Yes, so there are a vast majority that I could not cover, of course, in such a small window of time. So as a public health nurse, I just wanted to cover a couple of them. So brain disorders are conditions affecting the brain and the nervous system. So these conditions can include, but are not limited to, we have our neurodegenerative diseases such as Alzheimer's or Parkinson's. We have our vascular issues such as stroke, injuries such as concussion, infections such as meningitis, and mental illnesses as well. So again, even as a public health nurse, I would refer people to medical professionals for deeper information, but it's always good to have like a base layer knowledge. So symptoms of any brain disorder could often include cognitive decline, motor dysfunction, headaches, and sensory changes that affect millions globally.
So these symptoms could be experienced in any one of these that you had just targeted.
Yes. So it's very important, like for follow-up, it's important they look at the underlying cause. So maybe that person had high blood pressure, which led to a stroke, or maybe that person had Parkinson's. So they'll look at the underlying cause in order to help manage your life and help benefit the patient individually.
Which I know I've said this in shows past, the importance of keeping in contact with your primary care can't be overstated, correct?
Yes, yeah. So those annual physicals, make sure you're checking in and following up, because you want to, preventative care always will be more manageable and more cost effective if you're preventing the illness from occurring in the first place.
And I think, though it's a great tool to have the internet there for you to research, and I always say research, but bring that information to your doctor. In other words, if it helps you explain to your physician what you may be experiencing, that's great, but don't self-diagnose based on that.
Yes, with any condition, especially a traumatic brain injury, always seek medical evaluation as soon as possible, because medical evaluation is very important, and it has to be prompt. For example, if it were to be a stroke, the longer you go without treatment, the longer your brain goes without oxygen, so the more death to your brain cells. So it's all you want to make sure, especially with any type of brain injury, whether it's a concussion, suspected or not, follow up with your doctor.
And usually with concussions, coaches are very quick to respond to that and take no chances if they feel like a player could have experienced a concussion. The protocol is to send that person directly to a doctor.
Yes. So the state, I know working with summer camps, we require the camp counselors to be trained in heads-up training, so it's concussion training, which is a free program offered by the CDC. You can go right on their website for it, and that trains them the signs to look out for and what to do. But I do know, like working with summer camps, we've had those questions. If there's ever a head bump, we're going to refer to the doctor, and they have to wait for clearance to return back, because you cannot push through a concussion, and they need to seek medical care.
And we should mention that it's not like a cut where someone can see the actual damage done. The brain is, as you had mentioned, inside of the skull, so what you can't see could be an issue.
Yes, and even just thinking of like a simple trip, if you trip and fall and you bump your head, your adrenaline's going to go. You're going to want to jump up and say, I'm fine, I'm going to go home, I'm going to lay down. If I go home and I lay down, what if there was an internal brain bleed that I didn't address? So that is something, always call 911, follow up.
There's truth to, after you get hit in the head, I remember from years ago, make sure you don't fall asleep, because there is consequences to that.
Yes, yeah. So I didn't, just because of all the different types of brain injuries, I didn't want to go specifically in what to do. I wanted to simply leave it at call 911 or seek professional guidance.
Sure.
Of course, see a doctor. But there are definitely measures in place to, like, for example, if somebody did have a suspected concussion or a confirmed concussion, for example, 48 hours, low rest, you don't want to do anything stimulating like looking at TikTok, or you want to make sure you're relaxing. So they're very important to follow up with that medical provider to see what you should be doing post any injury to your brain.
So let's look at TBI, which again is traumatic brain injury.
Yeah, so the definition of a traumatic brain injury continues to evolve, but it's described as damage to the brain caused by a direct or indirect force applied to the head or body. So even like a car accident, if somebody's head is jolting forward then back, that still could be because depending on how fast they're going, that could be very traumatic. Even if you think you're fine, I'm just going to walk this off. Get evaluated at least by EMTs.
And that would be whiplash.
Yes, yes. So the TBI is diagnosed clinically by evaluating symptoms and physical findings, considering the timing of the symptom onset in relation to the injury, and using diagnostic imaging to support, when appropriate, to support the diagnosis. Symptoms may affect physical function, thinking, memory, behavior, and emotions. And especially when assessing older adults with a possible traumatic brain injury, it's also important to consider those underlying causes of the trauma. For example, do they have high blood pressure, and is this a potential stroke? But you would again evaluate a stroke differently than a concussion. So follow up with that doctor.
I know when my son had a concussion, he was playing, I think that's okay, the microphone can take it. He was playing football, or he was playing some kind of a pickup game with friends. And after he didn't hit another player, I think he went down on the ground and just his head bounced on the grass. And he couldn't focus. He had lost focus, or felt that something was different. And he did go and get checked out, and it was considered a slight concussion, but a slight concussion is a concussion.
Yes, yes. And also, as I have a toddler at home, I also think it's very important to follow up. When in doubt, call your doctor's office, see what they say. At least it will be on record with your pediatrician as well. And they would probably advise you to come in, but when in doubt, why would you risk not following up?
Absolutely.
Yes.
So let's, again, staying with TBI, traumatic brain injury, let's look at symptoms, neurological and physical.
Yeah, so we may have loss of consciousness, trouble remembering things that happened before or after the event, severe memory loss affecting many recent events, loss of vision even though the eyes themselves are not damaged, vertigo with nausea, so they may be very dizzy, feeling unsteady, lightheaded, or having trouble keeping balance, headache, noise or light sensitivity, sleep disturbances, insomnia, fatigue, and seizures. So definitely anybody who loses consciousness, because sometimes you might not even realize it. So you're like, I'm actually just going to push through. I'm fine. Never push through. Please seek medical care.
Well, I think that was our son's thought, that, oh, I just fell down on the grass. I got up. I don't know how quickly, I wasn't there, so I don't know how quickly he got up. Fortunately, he called us, and we told him, go get checked out. I'm not sure the folks that he was with, the kids that he was with, might have said something too, but again, don't ignore it. It ended up being a concussion.
Yes.
And I think at that point too, the doctor said, a concussion is a concussion. There is no such thing as a slight concussion. It's still considered a concussion.
Yes.
So bottom line is, if you've experienced anything like that, certainly don't play games. Go get checked out.
And I think it's also important, again, it is very, in our sports community, it is very much, everybody is trained to look out for it. The players should hopefully have a level of awareness as well. So they're looking out for it in themselves and others.
And I think even just to say what you had said about whiplash, the force that his head hit the grass might have, in a sense, been a little like whiplash if his head went back, out of place. So it could have been, which again, whiplash, you can get a concussion from whiplash.
Yes, yes. And a lot of doctors will probably err on the side of caution with this.
Sure.
But again, please follow up. It's very important. And it could save your loved one's life. Because if there was something like there was an internal bleed, that it could just worsen if they go home and fall asleep.
And that's my point. Right. So whereas you cut your finger, you can see the wound.
Yes.
With an internal bleed, you're not going to see anything.
Yes. Yes.
You're just going to experience some serious symptoms.
Yes.
Let's look at traumatic brain injury symptoms that are cognitive.
Yeah, so some cognitive symptoms that people may experience following a traumatic brain injury: anxiety, depression, irritability, a labile mood, impaired short-term memory, inattention, and language disturbances such as slurred speech. So you even want to think of this like in terms of an individual recovering from stroke. Their brain, like, it affects their cognitive health. So they might have a little bit more, they might be more irritable now. And you're like, you weren't like this before, just be how you were. It's important to have understanding for others and what they're going through. And I think the cognitive symptoms is very important to know that because, again, it helps you better understand yourself if you are the individual with the traumatic brain injury, or better understanding if you are the caregiver giving support. And it also goes to show like how much support and intervention they may need following traumatic brain injury.
And when we're talking stroke, I guess what comes to mind too, if that is in fact the cause, regular checkups, monitoring from your doctor could indicate if you could potentially have a stroke, if you're a candidate for a stroke.
Yeah, so they would manage like going to your annual visits. They will monitor any family history you may have, any history you may have that may increase your risk of certain, like for example, hypertension can increase your risk of stroke, smoking increases your risk of smoke, a family history increases that risk. For example, if you are an individual with high blood pressure, work closely with your doctor to get that under control. Because if you don't control it, it can be deadly. It can lead to a stroke, and if you just wait for that event to happen without prevention, it makes it a lot harder. Because if you do have a stroke, that could make your life harder because you now have an injury that you have to overcompensate for. Exactly. So it's all about taking care of yourself and knowing when to seek guidance and when to seek evaluation.
What is the treatment for health issues after traumatic brain injuries? I guess we'll look first at early intervention because that's critical.
Yeah, so I had to always follow up with a medical professional. Don't take your own advice. As you mentioned, the internet, it's wonderful because there's a vast amount of resources out there. But you do want to get help and diagnostic information from a medical professional.
Right, because we can also mention, first of all, you'd have to be able to interpret everything you read on the internet, and then on top of that, you might not be getting it from a reputable site.
Yes. So be very vigilant of that. Like a lot of the .gov websites or make sure .org are good websites too when you're looking at your information. But again, even as a public health nurse coming here today, this is information that is available online. It's a vast subject, so you still want to follow up with a medical professional who specializes in this field. But early intervention is critical. So any suspected injury or brain injury, always follow up. Screenings would include cognitive screenings, for mood screenings, Referrals to mental health resources. They can help with therapy, medication management, substance abuse counseling, symptom management, and disease management. So that is all with a coordinated healthcare team, so with your primary care provider, or they may refer you to the top providers in your area, basically. They also would do tracking, so like assessing cognitive, mood, and functioning over time. Assessments to barriers to care. So, for example, somebody who may have had a stroke, you look at their day-to-day life, like are they having difficulty brushing their teeth in the morning, reading the newspaper like they used to? Like there are physical therapists and therapists that can come in and find accommodations to help you better improve your life. And so it's social, it's working with your doctors, social workers, family support, there's group support, especially that is something online's good for, is there's a lot of online support where you could anonymously post something just to see, does anybody else feel that way? So it does bring a lot of people together. And the last thing was referrals to social workers and nurse case managers. Nurse case managers, very important. If you have one, reach out to them with your questions, because that's what they're there for, is to help manage your care and see what resources are available to you. That could make your life easier.
And when you mentioned barriers to care, that could also be a person that doesn't have insurance. That would be a barrier to care.
Yes, so that could be a barrier to care. Even with that, you have to follow up if it's a brain injury. You need because again, it's too risky to just be like, oh, they bumped their head, but they might be okay.
Well, especially, I'm thinking of healthcare costs being what they are. Even sometimes with insurance, folks might not run to a physician because they're concerned about the cost. But as you said, if you don't respond in a quick manner, then what you could end up having and experiencing from that could be a lot worse and a lot more expensive.
It could be loss of life. It could be
Absolutely.
worsening injury to the brain if you wait too long to follow up. So when in doubt, if a traumatic brain injury is ever suspected, I please advise you to call 911 and follow up with your doctor.
Okay, this question I know the answer to, because as the body ages, and the brain being part of the body, being an organ of the body, would age too. So does age matter in brain injury recovery? I'm going to venture yes.
Yes, so it does. As with many, as we age, we also are seeing as we're aging, we may have more comorbidities. Because we've had a lifetime of exposure to, like, for example, hypertension. We had a lifetime to develop that hypertension. So older individuals, they're at a higher risk for brain bleeds, slower recovery rates, higher level of care needs, a greater likelihood of existing medical and mental health issues that worsen functioning. I'm in a higher risk for mild cognitive impairment, dementia, and other neurological disorders. So that's why I think it's a lot of understanding yourself. And even again, if you are somebody who experienced a traumatic brain injury and you're working on recovery, even understanding yourself and like how your brain was affected, and there are areas to improve, but it's seeing what, it's all very individualized for that person. But I think understanding and having support from others is very important. So make sure you're not going through it alone, because there's a lot of people who also go through.
And there are, I suppose, proven methods of a recovery or a road to recovery after traumatic brain injuries.
Yes, and there's different, of course, there's many different brain disorders you may have and different ways you could get a brain injury, but follow up with that doctor, because the care, especially right after that injury, is very important. So you want to make sure you know what you should be doing and what steps to follow.
We will end with resources for folks. Of course, we know that this program because we announced it, is recorded in Quincy, Massachusetts, but we also know that this program plays throughout the country.
Yes, I always think of what other states think of my accent here
Or
in
mine.
Boston. But I do tend to pull from resources. Today we did the CDC, the Center for Disease Control and Prevention, Traumatic Brain Injury and Concussion. I also had articles from the National Library of Medicine, including the traumatic brain injury in older adults. I recommend, when in doubt, if people are looking for resources, call your local Board of Health and see what may be available in your area.
Very good. I think you did a great job for a half-hour program, and certainly clarity in such a complex organ.
Yes, yes. And so much of our body, it's a system working together, so much overlaps. So please, especially with any injuries to the brain, always follow up with a doctor, because you never want to assume. And then there could be severe consequences.
Absolutely. Well, thanks once again for bringing this to light. Thank you at home for watching, and please remember to support the local access center in the community in which you reside for more programming just like this.